Okay, let's talk about back pain. First, we'll talk about the most common causes of back pain and explain common terms that are often used in your x-rays and in your MRI results. Then we'll talk about different medications, procedures, and even surgical options that are used to treat back pain. Low back pain is one of the most common things that we see and treat here in the clinic, and I feel like people more than anything else just want to know what's going on with their back. And I think it's safe to say that by the time you watch this video, you'll have a better understanding of what's going on back there. One point that I really want to drive home and explain here is that not all back pain is the same, and that's why there's not one treatment that works for everyone. Okay, let's switch gears here for a second and talk about how your back works. If you understand how the back works and what parts tend to break down, it's easier to understand the concepts behind the treatments. Also, if you get familiar with the anatomy and the terms, that'll allow you to understand some of the terms that you see on your x-ray and MRI reports.
The human spine is made up of 24 spinal bones called vertebrae. The vertebrae are stacked on top of one another to create the spinal column. The spinal column gives the body its main upright support. From the side, the spine forms three curves. The lumbar spine is made up of the lower 5 vertebrae. Doctors often refer to these vertebrae as L1 to L5. The lowest vertebra of the lumbar spine, L5, connects to the top of the sacrum. Each vertebra is formed by a round block of bone called a vertebral body. A bony ring attaches to the back of each vertebral body. When the vertebrae are stacked on top of one another, these rings form a hollow tube called the spinal canal. As the spinal cord travels from the brain down through the spine, it sends out nerves on the side of each vertebra called nerve roots. The nerve roots that come out of the lumbar spine form the nerves that go to the lower limbs and pelvis. 2 spinal nerve roots exit the sides of each spinal segment, one on the left and one on the right. As the nerves leave the spinal cord, they pass through a small bony tunnel on each side of the vertebra called a neural foramen.
Here's a view of the spinal cord and branches. Notice how the spine sends out 2 different pairs of nerves off the main cord. Kind of looks like a tree with branches, right? Well, the spinal cord is like an internet cable, and it's how your brain talks to the rest of your body. The nerves in your skin and muscles also send messages back to the brain through the cord, especially messages about pain. When people hurt their back and have damage to their spinal cord roots, they often experience pain, numbness, and weakness downstream to the site that was damaged. So if you pinch one of the nerves in your lower back, it can actually feel like the pain is in your bottom or in your hip or even all the way down your leg. And that's definitely a point I want to drive home during this video. I can't tell you how often that people come in and they tell me that their hip is hurting and they're totally convinced that the pain is in their hip or in their thigh, and it turns out we get an MRI and it's actually a low back problem. Okay, let's zoom in and take a closer look at how the back is able to bend and flex thanks to discs and joints in the spine. Again, just to reorient you here, vertebrae are the bones that are stacked on top of each other like blocks. The gray stuff in between the bones are squishy discs that act like shock absorbers. Discs help our back to be able to bend forwards and backwards, twist and tilt. Okay, next let's talk about the joints that connect the backbones together, called facet joints. These joints, just like the discs, allow the spine to be flexible. And just like any joint in your body, like your knee joints, for example, these joints in your back can wear out over time, which is called arthritis. We usually see arthritis-type back pain more in people who are real overweight and people who are older. So I see this more in people when they get into their 50s and 60s and if they're very overweight. Okay, now that we've discussed the basic back anatomy, let's see what happens when different parts of the back break down and cause pain. Okay, quick reset of the main players involved. We've got the facet joints, that pasta-looking stuff, that's the spinal nerves, and then we have the discs. One of the most common sources of back pain is a disc herniation, and let's hear from a neurosurgeon about what causes a disc herniation to occur.
They're two vertebrae, and they're separated by the shock absorber, the disc in front. You can see on the right side, that's a normal disc, and the pressure inside is normal. But as we get older, the pressure in the disc drops. And those fibers on the sidewalls, like the sidewalls of a car tire letting the air out, those fibers get a little less tense and have a little more play, which is one of the big problems. So this shows you what the disc looks like. Everybody calls the disc a jelly-filled donut, and it really is. The interior jelly's like the air in a car tire, and as you'll see in the bottom right, when you twist, half of the fibers in the disc tighten up, and the other half loosen up. So just by the simple act of twisting, you lose 50% of the strength of the disc.
Wow.
And this is the biggest deal of anything in lifting, is that the twist is what's detrimental. People, when they twist and load their spine, are going to injure it.
Okay.
Now, if we don't mind going to the next. This is a picture of, on the left, the normal disc in the resting position. And as you lift, this is what happens to the back of the disc. The back of the disc is under significant tension. So you start to add these factors up. You twist, so you lose 50% of the strength of your disc, and then you bend forward, and you're putting all the stress on the back fibers, and you're developing a situation where you can start to tear the disc.
All right, boys, now watch how this is done. The key is to put it all in your groin and your back. Take your legs totally out of the equation. Lift with your lower back in a jerking, twisting motion.
Here's a nice animation of a disc herniating and pressing on the spine. This might happen, for example, when a person bends forward to pick up a power washer and then loads it onto a truck by twisting. Here's another view. Notice that the disc bulges into the nerve root here and not the actual spinal cord this time.
This cup represents one of the vertebra. This is the other. The green ball represents
The actual disc itself.
right. So this is a healthy disc here. It moves. It has some mobility in it so that you can move your spine as we all do. But if you get a bulge, just kind of zoom in here, Lonnie, and see how we're right where my finger's pointing. Right there's a bulge starting. Okay. And particularly if it's in the back where most bulges are, when you bend forward, it oftentimes makes it worse. Or when you lift weights with poor body mechanics and seated with poor posture, and that bulge can eventually, boom, turn into a herniation.
A herniation is when some of the inner material of the disc actually spills out back behind there.
Okay, next we're going to hear from a pain management doctor, and I really want you to pay attention to how he talks about the type of pain that results from a disc herniation. This type of pain travels or shoots down the hip and the leg. When people report this type of pain to me in the clinic, it's usually a big clue about what's going on in the back.
You'll see an example here of this red bulging disc or herniated disc. That just means part of the disc has come out and is pushing towards the neuroforamen area. This is the neuroforamen. That's where the nerve exits. When it pushes directly on the nerve, that causes mechanical irritation, and people have typically radiating pain that shoots down into the leg, shoots into the hip, shoots into the groin, depending on which nerve is irritated.
Dr. David Omi here. I'm a neurosurgeon and spine surgeon based in Melbourne, and today I'm going to be talking about sciatica. So what is sciatica? Well, sciatica is referred pain in the leg that comes from pressure on a nerve in the spine. Now, the causes for sciatica can be multiple. Patients with sciatica typically describe a shooting pain or an electric shock-like pain which radiates down their leg. It can go partly down the leg or it can travel all the way down into the foot. Now, how far the pain goes depends on which nerve is compressed, because different nerves go to different parts of the leg. Ultimately though, sciatica is treatable because once the pressure is taken off the nerve, the pain in the leg will improve.
Okay, I want to interject a quick point here. He says that if you can take some of the pressure off the nerve, the pain will improve. Well, when we talk about treatment here in a second, we'll talk about using things like steroids and anti-inflammatories, and that's why we are using them. We want to reduce the swelling around the nerve, and I just want you to understand kind of the purpose of the medicines here.
Now, in addition to pain, sciatica is often associated with some other symptoms A lot of patients will say, not only do I have pain, but I've got tingling, I've got numbness, my leg doesn't feel right. This is all related to a nerve being compressed or being unhappy, and it causes pain and the loss of feeling in the leg. So why do patients get sciatica? By far the majority of patients who have sciatica is caused by a disc herniation in the lower part of the back. A disc will herniate or prolapse and press on a nerve, and that causes the sharp shooting pain in the leg. There are other reasons outside of disc herniation as to why patients might develop sciatica. As we all get older, our spines wear out. Like some patients might have a knee problem or a hip problem, the spine can also wear out as we get older. The discs wear out and dry out, degenerate. The joints can become arthritic and bulge and press on nerves. Ligaments can thicken. The end result of this problem is pressure on the nerves in the spine, and when the nerves get compressed, it can cause sciatica or pain in the leg.
Now let's talk about another common cause of back pain called facet arthritis. This is arthritis of the joints of the back. Now as you get older, the joints of the back tend to break down, and this process is definitely more exaggerated in people who are overweight. In fact, for every 1 pound of belly fat that you have, it's like 10 pounds of pressure on the joints of your back. This is what happens to the thickness of the discs when you start to gain weight and the facet joints start to break down. Do you see how they flatten out? Now take a look at the holes where the nerves are coming out. They're getting smaller, right? So the result is that the nerves that are coming out of those holes start to get smashed. Here's a close-up of the facet joints, and the red is illustrating inflammation. So the pain from this type of problem is a dull, achy pain that usually stays in one spot in your back. And again, contrast that to a disc herniation that produces pain that shoots down your leg. Here's a nice close-up showing what arthritis of the facet joints looks like. Notice how the space in between the bones erodes away, and you've got a bone-on-bone situation there.
Here's articulating surface here where the bones rub together. There's cartilage in there, there's synovial fluid, and there's a capsule, everything that makes
It goes around it, yep. And the thing is, this joint, just like any other joint, can get arthritis.
Sure.
And that's the problem.
Yep.
So you can see, if you stand and you jam those joints together, that makes the arthritis feel worse. This separates the joints and takes pressure off them, and you'll see in a minute that's why you can diagnose this by some of the tests we're doing.
Sure.
So, all right. So the first thing, the signs is that, that it is facet joint syndrome. Is first off, it's going to be better sitting, because when you sit, those joints separate a little bit. They're not jamming together.
Right.
It's going to be worse with walking. Tends
Right.
to be. So if your back pain's worse with walking, and worse with standing, just prolonged standing. It also tends to be better. We have it called shopping cart syndrome. You feel a lot better when you're leaning on a shopping cart or leaning on something on a walker.
Right.
When you're bent forward.
Yep.
Because again, the joints are being separated.
Know that this feels better typically, but this feels worse, and the location of the pain is typically more pinpoint.
Right.
Okay.
So if you go back like this, you can also go off to that side, and that even jams it even more. So
Right.
let's say you're having pain on the right side.
Sure.
If you go back and to the right, and that makes it worse,
Yep.
we're starting to think that it might be the facet syndrome, the facet joint syndrome. If it's over here, you go back and to that side, hurts here, it may again be the facet joint syndrome. The other thing that this is going to happen mostly in people who are older. This is very unlikely to happen in a 20-year-old,
Right.
maybe even 30.
Yeah.
People who are starting to get pretty severe arthritis, they're going to be more likely.
More common.
Okay, I think it's really important for you to understand what this term is. The name is called spondylolisthesis. This is just a fancy way of saying that your backbones aren't all lined up straight, one on top of the other, and one is overhanging. The reason I mention this term is because it comes up all the time on people's x-rays, and I wanted you to know what it means. So this alone can cause back pain, as we'll see from the animation here.
Spondylolisthesis is a condition where the disc degenerates, resulting in a loss of disc height, causing instability and one vertebra to slip forward over another one below it. Degenerative spondylolisthesis is a consequence of the aging process, in which the bones, joints, and ligaments in the spine grow weakened and become less able to maintain the alignment of the spinal column.
So the connection between spondylolisthesis and facet arthritis is that when those facet joints degenerate, they lose their ability to kind of keep things stable, and then the bones start to slide forward. And when they slide, they scissor those nerves and cause pinching. Okay, we're on the home stretch now. The last term that you need to know about is this thing called spinal stenosis, which is really just talking about your actual spinal cord being pinched or compressed.
Now this is the site where spinal stenosis actually occurs. And spinal stenosis can occur for several reasons as we look at the spinal canal. There's a ligament which sits here in the back of the canal called the ligamentum flavum. As we age, that ligament can thicken, and as it thickens, it can compress the nerve roots inside the spinal canal. Secondarily, again, looking from the side at these cartilage discs, it's not uncommon as we age for these discs to start to degenerate. As they degenerate or start to thin, they can then bulge back into the canal. And as they bulge in the canal, you can imagine that the canal narrows over time and starts to compress the nerves. And finally, the third component that can contribute to spinal stenosis are the facet joints, or these little joints in the back. Now, these joints are just like any other joint in the body, and they too can or are susceptible to arthritis. And when arthritis occurs in these joints, the bone spurs can grow into the canal, and as the bone spurs grow in, they can pinch nerves or also narrow that spinal canal.
When that person stands upright and walks through the mall or the supermarket, they're actually leaning their lower back backwards. It irritates those nerves, and eventually as that person walks a bit, they get pain, usually down the backs of the legs. It can be down through the hamstring and even down into the calf. When someone with classic spinal stenosis sits, that pain goes away almost instantly because they're opening up those nerve holes and relieving the pressure on those nerves. The other classic sign is what we call the shopping cart sign, and that's the individual that goes to the supermarket and grabs the shopping cart, and they do great if they're walking with a shopping cart. They can walk all day long. As soon as they get rid of that shopping cart and walk straight up, they have a problem. Actually, what's happening is those individuals, unbeknownst to them, are bending their spine forward a bit and gapping the space around the nerves in the back, so they're automatically relieving the pressure and the irritation on the nerves and relieving their leg symptoms.
It is also quite common for people with lumbar spinal stenosis to experience nighttime leg cramps, often in the hamstrings or the back of the legs and in the calves. These are quite bothersome as they really can interfere with sleep. They can occur in one or both legs.
Okay, let's talk about the standard workup for back pain. The first test that we always order is an x-ray. An x-ray can show a lot of things. It can show fractures, alignment problems, arthritis. But from a practical standpoint though, we have to start with this because insurance wants you to get this before they'll pay for an MRI. So we have to just play the game a lot of times with this. The way that this will work, if we get an x-ray on you today, I'll place the order in the computer, and then you can go right next door to the hospital to have this done today after your visit. Just walk in the main front door of the hospital, and that's the picture here, and ask the help desk person where to go to get your x-rays done. Now the difference between an MRI and an x-ray is that an x-ray doesn't show the spinal cord and nerves, it only shows the bone. MRI is really the gold standard for diagnosing any back problem, and before a neurosurgeon or a pain management doctor will see you in clinic, you have to have an MRI first. Now these are done next door as well, but we'll have to get approval from your insurance company first, which means you'll be getting a call to set these things up at some point within a week or so. Now some insurance companies will demand that you've had both x-rays and done a trial of physical therapy before they'll pay for an MRI, so just know that. And that was a nice segue into our next topic, physical therapy. Now, physical therapy is a huge part of recovering from back pain. I'd say nearly 99% of the time I refer a patient to a neurosurgeon, they write in their note that they want the patient to try physical therapy before they'll consider doing any type of surgery or procedure. Okay, so what goes on in physical therapy? Physical therapists do things like ultrasound, which we see here, Ultrasound definitely helps muscles to relax, it increases blood flow, and it helps to speed healing. And although we haven't really specifically talked about this, but a lot of these back injuries will cause muscle spasms. So the back muscles will clamp down around your spine to try to stabilize things. And these types of therapies will help your muscles to relax a little bit and can definitely help with the pain. They also do electrical stimulation, which helps the muscles to relax. They do things like massage, they do stretching, they do ice and heat therapy. But also, they'll teach you more about your back pain and they'll give you some stretching exercises to do at home that really help.
Well, with physical therapy for back pain, there's a number of options that are available, a number of methods and a number of techniques. It's usually a big part of the therapy is to try to restore the flexibility of the joints. Once that is accomplished, then you would then move on to the strengthening component. Try to see where they're weak and what muscles need to be addressed.
Lastly, here's a little animation that shows you what's happening with a bulging disc when you perform this certain physical therapy maneuver. What's interesting here is you can actually see the disc starts to pull away from the nerve when you do these stretching exercises. So there's definitely some real validity in doing these. And then another interesting thing that I want to mention is that 90% of people will get total recovery of their back pain after 4 weeks of physical therapy. So it's definitely worth a try. There's some great prescription medications out there that I use to treat back pain. The emphasis is to use medications that help with swelling and inflammation so that we can free up space for those nerves that are getting pressed on. I'm going to take a few seconds here to go through each medication and explain how they work, and you'll notice that each one works differently, which is why we tend to use several different medications in combination to get the best results. The first medication I always use is called meloxicam. This is something that the neurosurgeons always use too. Meloxicam is a lot like Advil, but it's stronger and it works better. Of all the NSAID type medications out there, which include things like ibuprofen, Aleve, naproxen, this has the lowest side effect profile on the stomach, and so there's less acid reflux. Of all the medicines in this class, it's the one that penetrates the joints better than any of them. It's once a day, which is also nice, and I tend to start people out on the max dose, so please don't take more than 1 pill a day. Another great medication for pain is called gabapentin. This is taken as needed, and you can actually take it up to 3 times a day if you really need to. But because this one can make people feel a little bit snowed under and kind of foggy, I usually tell people to take it at night before bed, and it works great that way. Definitely works differently than meloxicam because it blocks the conduction of the pain signal from the nerves that are being pressed on or irritated. Another cornerstone of treatment for me on back pain is steroids. This can be given either in clinic as an injection called Decadron or in a pill form called a Medrol dose pack. And a lot of times I'll just end up doing both. I'll give people a shot in clinic and then send them home with the Medrol to be started the next day. So these aren't steroids like bodybuilders use. These are actually called corticosteroids, and they're great at helping to get rid of swelling. One thing to know about steroids is they definitely make you feel like you've got a lot of energy, like you've had 4 or 5 cups of coffee to drink, and people tend to get kind of revved up and energetic. So if I do send you home on the oral steroids called a Medrol dose pack, you don't want to be taking those late at night. You want to take your last dose of those medicines like around 5 or 6 o'clock. Okay, the last few things here, I promise. Some people don't do well with physical therapy. The pain medicines just aren't helping them, and we ultimately have to get them in to see one of our pain management doctors. Baptist has 2 fantastic pain management doctors, Dr. Kent and Dr. Judkins, and they're right across the street in that gray building called the Thomas Building next door. What's really cool about pain management is they use image guidance to inject the medicines right where the problem is in your back. So like we learned about the facet joints, they can put the medicine right in those joints. If the problem is where the nerve is coming out of the spine, they can put the medicine right there. So a lot of times people can find great relief from their pain by going to those guys. The last option for most people is to see a back surgeon. This usually happens after you've had an MRI and the MRI shows something that needs surgical intervention. Again, the vast majority of people are going to get better without surgery, and in most cases, it's worth trying the medicines, doing the physical therapy, and even pain management before you'd want to consider something like this. Having said that, we do have an amazing team of neurosurgeons here at Baptist, and I work really closely with them. In fact, I tend to get an opinion from Dr. Blake Phillips when I see an MRI that's even borderline for surgery. I'll call him and we'll discuss it, and then I'll call you and let you know what he thinks. Oftentimes that'll save you time and a copay of seeing him, just to tell you that you're not a surgical candidate type of thing. Okay, I'd like to wrap this up by giving you some basic advice that I think everybody with back pain needs to understand. First, you really need to pay attention to your body mechanics when you reach down to pick something up. Once you've injured your back, it's so much easier to hurt it again, so pay attention to this. This might actually be the most important thing in this entire video, just to teach you how to avoid injuring your back in the future.
You need to lift something. Let's say that something is about 1/3 of your body weight or less, up to 51 pounds. Moving it properly is easy. Simply bend at the knees, grab that something, and lift using your leg muscles. Oops! Keep it close to your body. There you go. Nicely done. Upright back, close to your body, use your legs, all excellent rules of thumb.
Slowly lift with the power coming from your legs, raising the load close to your body. Keep your elbows in and try to keep your spine in its normal position. Tighten your stomach muscles and lift smoothly without jerking. When you set down or lift a load, most of the power should come from your legs.
Let's say you have to lift more weight or lift it through a greater distance. You should not attempt the lift by yourself. Ouch! Instead, use a hand truck like this, or flag down a coworker like this. Good work! Or, what if the lift is to the left or right of you? Even if it's fairly light in weight, twisting your spine during a lift can hurt your back.
Twisting puts a lot of pressure on the soft tissues of your spine.
So turn toward the object nice and square. Very good. Then lift straight up. Now pivot your entire body and move the object. You're getting good at this.
In the way that I practice medicine, I'm really big on looking at the root cause of any sort of problem. And with back pain, a lot of times the main root cause is just being overweight. Let's hear from a neurosurgeon and hear what he has to say about this particular issue.
Well, so if you're carrying more weight, and particularly if you're carrying more weight in the front and you're leaning forward, that's more weight that's loading your discs, loading your nerves. So any weight that's in front and you're carrying puts more strain on the spine. And another interesting fact is any weight that you're putting in front of you, the further it is in front of you, the more weight is transmitted to the spine by a factor of 3 because of the distance. So it's magnified. Here you hold a weight, there's almost no effort on the spine.
If you can lose weight and strengthen your core, you are so much less likely to end up in this situation again. Okay, that's it. I hope you enjoyed this video, and I hope you've learned something about your back pain. Sit tight, and I'll be in the room in just a second.